Hello, my name is James Kirker. I'm an associate marriage and family therapist in Southern California who works for Kaiser and is on strike here. Today is day 54, I believe, that we've been on strike. Southern California psychiatric department workers. And I wanted to react to this Kaiser video that they released. So let's check it out. Thank you.
Hello, I'm Dawn Gillum, a licensed clinical social worker with more than 17 years of clinical practice and leadership in behavioral health care.
And I'm Rhonda Chabran, and I too am a licensed clinical social worker with more than 25 years of caring for our members and the communities we serve.
I'll say my experience too. I'm James Kirker. I'm an associate therapist, which means that I'm working towards being licensed, and we have to accrue about 3,000 hours before we can take the licensing exam. Um, I've worked in the field for over 4 years, and I've finished my hours. I just haven't taken the test yet because I'm don't have any income now that I'm on strike, so I haven't signed up for it yet, and I'm waiting on that. My experience has been in my community, and working down the street from where I grew up at a crisis house where I did my internship, my practicum, and I worked for about a year. And then I worked in a private practice for a year where I worked with a lot of Navy personnel. I'm also a veteran, and that was very awesome. And I worked for Kaiser for about 2 years now. Now in the clinic, also right in the same community where I grew up. So definitely a lot of us are serving our community after, our education. Okay, let's get back to the video.
Together, we lead the behavioral health program for Kaiser Permanente in Southern California. On October 10th, Kaiser Permanente received a strike notice from
Okay, so they lead the behavioral health department. I don't know who they are, so they must be, at some admin place, and so they're not on strike. They're not part of the union. And let's see. I want to mention really good production value. They probably Kaiser probably hired somebody to make sure they had good wardrobe and all of that, and they're saying this message that some person probably wrote for them to say. Um, let's see, they look a little nervous, so it's probably because the things that they have to say aren't exactly you know what's happening, or because they have to do this thing that's going to kind of be insulting to us, the people that are in the trenches that work for Kaiser, and we're not the people in charge. But okay, let's get back to the video.
the National Union of Healthcare Workers, which represents our non-physician mental health and addiction medicine professionals and social workers in Southern California. The union is now beginning an open-ended work stoppage at various Kaiser Permanente facilities.
Yeah, so they always refer to the union, NUHW, which is the union that we're a part of, that is on strike. All of our psychiatry people in SoCal, in many, many cities and many clinics, and we're the union, the people that work for Kaiser, the therapists, the psychologists, the psych nurses. We're the union. It's not like this, random people that are trying to shut things down. It's us, the people that do the work. So I don't know. That's kind of weird, but here we go.
Throughout Southern California.
We want our patients to know that our highest priorities are patient safety and continued delivery of high-quality care and service. Kaiser Permanente will continue delivering mental health care during a work stoppage, and we have comprehensive plans in place to minimize potential disruptions and provide timely access to care.
Okay, so access to care was, being pushed to the limits when I was there, when all of my peers were working. So it's probably not very good right now. Like we want to get people in within 2 weeks, and sooner if they need to be seen. And you know, I was right at the edge of that. And usually not getting people in within 2 weeks. Luckily, not luckily, but it's fortunate that not all of them needed to be seen in that time. But people deserve to be seen in a timely manner, and I really doubt that that's happening right now. I've heard a lot of stories that it's not. We do have a great external network that we refer people to see, but they're not really able to see people as timely as necessary if all these patients are being sent to them. And yeah, okay, let's keep going.
In Southern California, we provide mental health care and addiction services through our employed Kaiser Permanente professionals and an external network of contracted providers. This will allow us to continue care. Patients will have the opportunity to be.
So I will mention that Kaiser has been hiring scabs who are making in a week twice what I make in 1 month. And I've heard that they're really stressed out and they've been quitting. I heard that somebody walked out of a group therapy and quit because they couldn't take it. And I've heard there's been like a lot of unprofessional behavior going on. But instead of, addressing this, instead of supporting the people that do this work, that work for Kaiser, Kaiser chose to hire these people and spend way more money than what would be necessary if they would, do what's right here. So it doesn't really make sense, not from a patient care perspective, and not from caring about your employees' perspective. But here we go.
Be seen by another professional in our extensive network of highly qualified licensed therapists if their regular providers engage in a strike.
Yeah. So along with so if people are quitting and coming in and leaving these scabs, people taking our work, patients are seeing a different clinician, every couple of weeks if they're able to be seen by somebody. And a lot of people prefer in-person therapy, so that's probably not happening, I would guess. Like I don't know. Here we go.
Where necessary, we are contacting patients and offering options that meet their needs. We will continue to reach out directly to patients during this work stoppage. Our medical centers and medical offices will remain open, including our hospitals, emergency departments, urgent care departments, primary and specialty care departments, pharmacies, and laboratories.
All those departments are open, and if you need help, go in. Um, those aren't the psychiatry department, though. That's not the departments that are on strike. Those are departments that are already open. So, yeah, okay, here we go.
Please know that we have urgent and crisis services available at all times. We are here for you.
Kaiser Permanente has a
There are urgent and crisis services available. They're probably not provided by Kaiser because it's probably like, uh, the mobile response team, the access and crisis line, and emergency rooms, things that were already available that are there, resources like 988. So basically, they're saying, yeah, we can still, take care of a crisis, but it's not us because our workers are not working. Okay.
long history of working successfully with labor. We work with more than 40 unions and employ the largest number of represented healthcare workers in the country. We have always operated with a focus on being fair and doing what is right for our employees.
Yeah, they look like they're a little nervous there. Maybe because that's not true. And they're not agreeing to give us something like a fair agreement and the same benefits and the same resources that our peers in the north of the state, Northern California and other states have. So I don't know. They look really nervous and really uncomfortable. I feel kind of bad for them, but yeah.
We strive to ensure that they are paid above the market. Our mental health workers' pay in Southern California, in particular, substantially exceed the market.
The pay is good. I have to admit that we're up there as far as an associate job. Like I am an associate. The pay is really good. There are other places paying the same amount that also in my city that are not on strike that I could apply to. As an associate, I'm not able to do online, platforms because I need a supervision weekly. So if I, choose to do one of these jobs, I'd have to make a commitment to that because ethics are important to me, and I might have to leave Kaiser. So I mean, the pay is good. There are other places that are offering equal pay as what we make at Kaiser, though. To be fair, I guess it's true that they pay well. Um, that's why people always call them the golden handcuffs. If you've ever heard that, it's a thing that's said about Kaiser because in some departments it's very difficult to work, but they pay well, so people choose to do some things that are difficult.
Our current proposal would further increase wages more than 18% over the next 4 years. It also includes a 2% longevity stamp increase after 25 years of service. Kaiser Permanente's latest offer also enhances the comprehensive benefits our mental health professionals enjoy, such as low copays, no deductible, and no employee premium cost sharing.
That's true. I don't know if our copays are low though. I think it's probably the same as like a good plan. I know that it's not zero, and there are probably other, jobs with Kaiser that don't have a copay. Um, and so, that kind of surprises me. If we work for the company, why are we paying like that much? Like I don't know. But yeah.
This is on top of the current retirement plan that includes 9% company matching.
So we have a 401k, but no pension. Um, Other people at Kaiser have a pension, and even people that do my job in the other part of the state, again, Northern California, have a pension. And what I hear is that last time there was a negotiation, they took away the pension because I don't know. It was something that they negotiated out in 2014 or something. So other places have a pension. We want a pension. The pension would be great because, when we retire, that would be helpful. Some of my coworkers even have a pension, people who have been working for Kaiser for a number of years, and they're on strike because they want us to have the same benefits that they have and our peers have. And we want equity. We want things to be fair. Um, yeah, okay, here we go.
Which is way above other employers in the market. We also know how important it is for our mental health professionals to have the appropriate time and support to focus on providing high quality care. That is why, in this latest proposal, we have included up to 6 hours of administrative and planning time per week, with 4 of those hours protected. Our offer has no takeaways.
Okay, let's talk about that right there. So right now we have 4 hours of what's called patient management time, where we are able to, per week, where we're able to make calls, answer emails, write notes, and do all these things that we need to be doing in our roles that we're required to do. We're required to call people back when they need to talk to us. And, we get a lot of messages all the time. It's necessary work. So basically, they're saying 6 hours, 4 hours guaranteed. We already have 4 hours. So that means that they could give us the same amount of time, 4 hours, and fill those two slots as necessary, which they will do because we need to see patients. We don't have enough people to see everyone within that 10 days, 10 business days time. So they're basically saying that we're going to give you the same amount of time, and but it's 6 hours, but we're only guaranteeing four. On top of that, what they are not, no one's saying is that the 4 hours is based on how many patients we see. We see like on average about 30 patients a week. We have a lot of meetings. We might see more or less depending on what's going on that week. Um, for myself, I support the clinic in a role where I answer calls on some days for people who need to talk to somebody right away and need to be assessed right away, or if there's a walk-in. So I'm still meeting with patients. I'm still doing. I'm still busy. Every minute at Kaiser is scheduled for something. There's no like free time. So that 4 hours for me, to um, it's reduced to like instead of having 4 hours, I might get 1.5 hours a week to make calls to patients, to write notes, to do anything that I have to do a training. We have all kinds of trainings that are required of us. I have to call people back within 4 hours. That's the goal if I get a message. So I have like a half hour on some days to do that because I'm doing this other role where I also talk to patients, but my patient managed time gets reduced because of that. Even though I'm busy and I'm working, that time is reduced. So if they give us the 6 hours, 2 hours are not guaranteed. We're still at 4 hours, and then that's going to be further reduced. So I'm still going to be at 1.5 hours. So on top of that, we have a half hour lunch, right? Unpaid on 4 days. Like probably any employer, they're gonna not pay you for lunch on 4 days. One day we have meetings and we call it a working lunch. So that means that we work instead of having lunch, we're like, grubbing off camera on Zoom meeting so we can make sure we eat something. So I when I first started working for Kaiser, I was really surprised that we didn't have like breaks scheduled. But I guess that's how we do it. So I think they're also they give this big number about how much time we're asking for, and they are saying that it's like 40% of our time. But the truth is they're counting like 10 minutes for every patient we see. So they want us to be done with a patient in 50 minutes, but that doesn't always happen. Like my patients might need more than 50 minutes. Plus, I have to walk them, in and out of the lobby. Um, I might have to use the restroom. There's no like schedule time for the restroom, so I have to run to the restroom. And I heard people have had uh, UTI, urinary tract infections, because of that, which is insane. But no time for the restroom or making a call. the way that it works out, there's like usually a day or two where I see patients back to back, and I have a half hour unpaid lunch, and then I see patients back to back until I go home, and I have no time to complete notes. It's probably rare that I'm completing my notes the same day, so because I have to jam through them and record what I need to record if you know I'm seeing people back to back. But so that 6 hours that they're saying is not guaranteed. It's 4 hours guaranteed. We want the same as Northern California, guaranteed. And even that will be reduced depending on how many patients we're seeing and what roles we're doing. Because, like I said, there's some days where I'm, doing this other role, on-duty clinician role, and that reduces my time. So even if they gave us this amazing 6 hours with 4 hours guaranteed, I would still have like an hour and a half if I'm supporting the clinic in this other role. So I don't know. It's not really like they're adding anything on. They're I don't know. It's like a scam. They're saying, oh, 6 hours, but we're going to give you four. And then, oh yeah, that's reduced because you're doing this other job. So and on top of that, sometimes patients don't show up. Sometimes people they don't want to talk on that day, or they forget, or something happens where they can't make it, and we're penalized by instead of having that note-taking time or that calling a patient time, we're scheduled with another patient on another day. So I don't have that time because I have to meet with another patient instead of having time to take my notes. And I don't know. It sounds pretty insane. Okay, here we go.
and is aligned with our goal to ensure that Kaiser Permanente remains a great place to work for our NUHW represented employees. It is also aligned with our responsibility to provide high quality and affordable care for our members. It's unfortunate.
Um, my clinic is amazing from, interns all the way up to the director. My director is amazing. So, that's true. We have awesome people doing the best that we can within the system. But we put ethics and our patients first. And like I said, with the no-shows, they're saying, "Hey, you need to do more." Um, I, I'm gonna make sure that my patients are okay and that I'm seeing them as soon as I can, and that's the goal. Okay, let's see. Here we go.
And irresponsible that NUHW is exploiting this post COVID environment when mental health care in the U.S. is in crisis, to ask behavioral health care professionals to go on strike and stop providing.
So again, it's like the union's like a separate thing here. We, as union members, people in the caring profession that work for Kaiser and SoCal Psychiatry, all of our workers voted to go on strike. It's not this like, nameless, faceless union. We voted 80% of our members, over 2,000 people voted to go on strike. Before any of this went down, our union was asking Kaiser to meet us for negotiations for months, and they didn't do that. Not until like a month before our contract was going to end. So they, waited, and we were waiting and waiting. Come on, let's talk. But their behavior is like pretty wild, and I'm annoyed, but not surprised because I don't think their negotiators care about us or, our patients. They just want to win and, make money. And when they've spent way more money than would be necessary to help us or to hire regular workers on like scabs and great production videos like this one that we're watching. So, okay, here we go.
Needed mental health care. NUHW leaders have been threatening to strike since before we began bargaining in July. The union has operated without an apparent sense of urgency, declining to accept.
This is definitely not true. We've been asking for months before the strike for Kaiser to negotiate with us, and they didn't do that in good faith. They didn't come to the table. So, yeah, I don't know. This is like a straight up lie. So that's probably why they look really nervous in this video. Like, they're insulting the people that that work for them. They're insulting us. They're not being truthful. They're not supporting us. They're not doing what's best for the patients.
Or meaningfully counter the strong proposals Kaiser Permanente has put on the table. The union's proposals at the table have been overreaching and unreasonable.
So I would get the update whenever they were negotiating at work, and I'd read it, and and people that have gone there to watch, they would not come back with a meaningful proposal. It was always the same. Like, okay, we'll give you 6 hours, but only 4 guaranteed. The same as what we already have. Okay, we'll do this. Nothing about the pension. Nothing about giving us enough time to take care of our patients. It was like the same, or like, oh, we're done for the day, and like really bad behavior. But maybe that's because the negotiator is not like a therapist. The people in charge are not, providing patient care. Their job is not to make sure that the patients are supported or the people are supported. It's to make money and make sure that they make money for their investors and whatever they need to do. So maybe that's why. But they've already spent a ton of money. Like instead of I don't know. Doesn't make sense there. Okay. Maybe maybe they're doing this because they don't want to they have other negotiations coming up and they don't want to I don't know, give in because they're worried about actually having to support their people. Okay, here we go.
NUHW is putting pickets before patients. Instead, NUHW should engage sincerely at the table to reach an agreement that is good for our therapists and our patients.
I'm a therapist, and that's not, really what's been happening. If they cared about the therapists, they would be supporting us. The union's supporting us. We've received like food donations because we're not making money and we need to eat. Um, I'm barely getting by. I would probably be homeless if I didn't have family. San Diego is an expensive city. Southern California is a very expensive place to live. We just want equal, equity, equal pay, equal benefits as our peers. And, you know, uh, they're referring to the union again as this, other body when the union is us.
We understand give and take. We will continue to negotiate in good faith until a deal is done.
Oh, something I wanted to mention is that I, I probably would have went back. Christmas is right around the corner, and I don't have any money to buy gifts. I'm not going on vacations or anything like that. I'm eating at home. I probably would have went back if things like this video wouldn't have came out. If they wouldn't have lied about what's going on. If they wouldn't have called the police. on our food donation truck, which they did in one city. They called the police, and they tried to stop the food donations to us, which is wild. So yeah, I would have went back if Kaiser was actually in good faith, but like my peers, one day longer, one day stronger. I'm going to, instead of going back, I'd rather find another job. I don't want to, cross the picket line if, with this behavior. It's, if their message would have been the truth, actually consistent with what, my experience, I might have went back, but, it's not.
We ask the same of NUHW.
We want our patients to rest assured that Kaiser Permanente is focused on all of you and your behavioral health care needs. We have extensively planned for this strike given NUHW's behavior and are well prepared to meet your care needs. Thank you for your time.
Um, if you're a Kaiser patient and you're not being seen in a timely manner, you should complain. They're absolutely right. You should be seen. You should have access to health care that you're paying for. You should have people to talk to that support you, and that's probably not happening. It was barely happening when I was there, and Kaiser was fined for that, as you probably know. So you deserve to be seen. You should call member services, check out our website. Let's see, kaiserdon'tdeny.org to take a look and see what's really going on. Okay, let's see if this is the end. Yeah, okay. So let's see. That was my reaction to this Kaiser propaganda video. Um, what they're talking about is not in line with what's really happening, and it's all we want is equity, equal benefits and equal pay as our coworkers. We want the same amount of time to call patients, not 1.5 hours. That is my experience. So no time to call patients some days, no time to use the restroom, no time to provide patient care. Thank you for watching. Again, check out kaiserdon'tdeny.org to see what's going on, to support the union. And if you are not being seen by your Kaiser clinician, call and complain. Let them know that you want to be seen and you deserve to be seen. And, that's what you should have in our great state. Okay, thank you very much.